Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Ms. Wayne, as this is your first appointment with me, I'd like to ask you a few questions and get to know a little bit about your medical history. It's also a chance for you to ask me any questions you might have.
Sure.
I understand from your GP that you have arthritis.
That's right, yes. It's in my hands and wrists mainly. The finger joints in my hands get really puffed up when they're swollen, like they are now. The pain can get so bad that it stops me doing a lot of very simple things. Things like having a shower or getting dressed. Then there's the trouble I have making breakfast. Anything where I have to grip and move my wrist, like holding the kettle and pouring, or buttering some toast. Well, you get the idea. It's not like I'm an old woman, I'm only 40.
I see. Tell me about your work.
I used to be a hairdresser, but I had to give it up after my hands started getting really bad. I couldn't just sit around the house and do nothing though. So now I go to the local primary school where my kids are and help the children with their reading. And just lately, I've started helping out on the telephone helpline for people with disabilities. They have these special hands-free phones, so it means I can do the work without needing to use my hands so much. It's only a volunteer position, but I really feel like I'm doing something worthwhile.
Is your mobility affected at all by the arthritis?
I do have trouble getting in and out of bed or out of a bath. I also need help getting out of a chair if it's a bit low. I move around the house with the walking aid I have, and when I go out, I tend to use a wheelchair. Our car has also been modified, so at least I'm independent. I can go to the shops or out with friends.
I'm guessing you've had physiotherapy treatment before.
Yes. In the past, it's mainly consisted of heat treatment, but now I'm really interested in some sort of gentle exercises, if that's at all possible. I also really want to make sure that my hand splints are still helping, and not making the condition worse.
Sure, I can look at that for you.
I've also been to an occupational therapist before. I needed help when things started getting really difficult around the house. I found her very helpful. She had lots of gadgets to help me do things like dressing and cooking, and so many good ideas about how to help with my tiredness without making the pain worse.
Okay, we can talk more about some of the techniques you use to help you at our next appointment. What about your medication?
I take analgesics for the pain mainly these days. I used to take those, those anti-inflammatory drugs, but the benefits seemed to wear off and they started making me feel sick, so I had to stop taking them. I do sometimes get a steroid injection, but not very often. It works really well at reducing the pain for a few weeks, but it hurts like hell. Dr. Wong has mentioned a steroid tablet I could take, which will work in a similar way. So we might be looking into that soon. And a couple of times a day I have an analgesic cream that I rub into my hands. I don't know if it really works very well though.
A doctor talking to Mr. Roy Daphnis about his planned hospital admission. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Mr. Daphnis, this appointment is a chance for us to talk a little about your upcoming surgery and for you to ask me any questions you might have.
Okay, yes. Well, I don't really have any questions about the surgery itself. I feel I understand the procedure quite well from all of my reading, but I do have a concern. I'm actually quite worried about how I'll go with my eczema when I come into hospital. It's important for me to follow my usual routine, you see, or it will flare up again.
What is it specifically that you're worried about?
Well, I've had eczema for years now, since I was a kid. It's chronic, I guess you could say, and there are all sorts of things that make it worse. Like getting too hot, you know? Like I'm in a room and the sun is shining in through the window and it starts getting very stuffy or something.
Okay, we can make sure that you have a bed well away from any windows if that'll help.
Yes, that would be good. Thank you. As long as I'm in an air-conditioned room and it isn't too hot, that usually helps. I also notice that certain foods and drinks make it worse. I stopped drinking alcohol years ago because it always made the itching worse. But I also have a list of foods that seem to aggravate things. So I was wondering if it's possible to give that to someone, or if I can let the hospital know so that they don't include any of these foods in my meals.
If you contact the hospital directly, they'll be able to help you with that.
Great.
Tell me, Mr. Daphnis, what's your skin like at the moment?
Not very good. You can see by my face how red it is, and the itching and scratching has been much worse lately. I think because of the stress I'm feeling about the operation. It's also really bad on my back and my legs. When I lie down in bed at night sometimes I can hardly stand it.
Do you ever get any sores or weeping?
No, my skin is just dry and very itchy. But I'm most worried that because of the operation, any broken areas in the skin will mean I'm at risk of an infection. I'm doing everything I can to prepare properly though. Instead of showers, I've been taking lukewarm baths. And I never use any soap because it leaves my skin extra dry. I know using it removes the natural oil, so I use a soap substitute instead. I'm being really careful about the clothes I wear to be sure that they aren't going to exacerbate the itching. I really don't want to be scratching it at all if I can help it, and I've been using an oily moisturiser nearly every hour. I don't like to use a lot of those steroid creams and things, but I can if you think it'll help. I see a dermatologist sometimes and he said if I don't like using them, I can save them as a last resort.
Okay, it sounds like you're doing everything you can to manage the condition, but you do need to try and relax and make sure you're getting plenty of rest. I know that stress is only going to make the condition worse.
You're right. I know I'm probably getting worked up over nothing, and everything will be fine. I'm taking an antihistamine at the moment, so that's helped with the scratching, and I'm sleeping a bit better as well.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen.
You hear a physician talking to a group of trainee doctors. Now, read the question.
Honeybees have barbed stingers that are left behind in the person's skin after the initial sting. If the stinger is removed by pinching the stinger, more venom is actually injected, so it's better to remove the stinger by gently lifting it using a pair of tweezers to remove it from the skin. Generally, honeybees aren't aggressive and only sting in self-defense. However, in some cases, a person will disrupt a hive or swarm of bees and get stung multiple times. If a person gets stung more than a dozen times, the accumulation of venom may induce a toxic reaction and make them feel quite sick. And multiple stings can be a medical emergency, especially in children, older adults, and people who have heart or breathing problems. So make sure to check with the patient and be aware of the signs of multiple stings.
Listening Part B. You hear two dentists discussing a patient. Now read the question.
I've just seen Mr. Butler, one of your regular patients. He's been in some pain recently.
Right. I've been fully booked for the past few weeks, and he told reception he couldn't wait any longer. He's had chronic periodontitis for some time now, but I gather it's worse.
Yes, I provided thorough curative treatment in all quadrants today, but his gums were in such poor condition and there was severe mobility in his lower right first and second molars, so I had to extract them. I've scheduled him for implant surgery, but I'm worried about his broader health issues and whether or not he's been taking biphosphonates. I couldn't find any information in his records about it.
There isn't any, no. You may have to contact his GP.
Okay, I certainly want to reduce the risk of any osteonecrosis after surgery. Listening Part B. You hear an optometrist giving a presentation to a group of teachers. Now, read the question.
About 1 in 12 boys is colourblind, and 1 in every 400 girls. So in each school class there are likely to be at least 1 or 2 students who are colourblind. Because they are colourblind from birth, most people don't know that they're colourblind. They don't know that other people see things differently. Being colourblind can cause difficulties when it's important to be able to see lots of colours, such as on a computer screen or in art classes. Boys should have their colour vision tested when other people in the family are known to have colour vision problems. If people on both sides of the family are known to have colour vision problems, then girls should also be tested. Colour vision testing can be done by optometrists using specially designed charts. Some school health services and some doctors will also be able to test colour vision.
Listening Part B. You hear a radiographer talking to a patient about their CTC examination. Now read the question.
Okay, so your appointment's scheduled for 8:30 next Tuesday morning.
That's great. Thanks for organising that.
No problem. Now, the main purpose of the CTC examination is to look for abnormalities or polyps in the large bowel with the use of a CT scanner. So that means 3 days before the test, you'll need to start eating a low-fibre diet, and then 24 hours before the test, you'll be drinking clear fluids and you'll need to abstain from alcohol. Then on the evening before the test, you'll need to take laxatives as prescribed by your doctor with several glasses of water. You also can't have any breakfast on the morning of the test, and we'll need you to be self-administering some suppositories at that time. But all of this information is set out in the letter. If you've got any questions or concerns about it, make sure you contact either myself or your doctor.
Okay, thanks.
Listening Part B. You hear a physiotherapist speaking to a support group for Parkinson's disease. Now read the question.
The physiotherapist's aim is to maximise the patient's functional ability and quality of life. Physiotherapy can help alleviate symptoms like tremors, rigidity, slowness of movement, and impaired balance, which can cause abnormal gait and posture. It can also help with cramps and pain in the muscles, and even help patients who experience reduced fine motor coordination. Physiotherapists use physical treatments such as exercise to prevent or reduce stiffness in the joints and to restore muscle strength and mobility. As well as this, physiotherapists can supervise the patient's exercises to help maintain their posture and balance and advise the patient about ways of preventing or reducing the risk of falls. Physiotherapists use other treatments such as heat and cold or electrical equipment like ultrasound to help relieve pain patients may have. They can also advise or train parents and guardians of patients suffering from Parkinson's disease in safe and appropriate ways of helping them with mobility problems.
Listening Part B. You hear an oncologist talking with a patient about their test results. Now read the question.
Well, I'm happy to report that the colonoscopy has found no evidence of cancer.
Are you sure, Doctor?
I know you're worried because your father had bowel cancer, but your tests came back negative, so that's a good result for you. And let me reassure you, we can see cancer if it's present in the colon in more than 90% of cases. So we miss very few early stage cases.
That's a relief, Doctor. It really is. But then we still don't know why I'm experiencing these abdominal pains.
Actually, we do. We've discovered that you have something called diverticular disease. Have you ever heard of this condition?
No, I haven't, but it sounds pretty serious.
Well, if we follow the proper management, it doesn't have to be so serious. Let me tell you a little bit more about it.
This is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 through 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a medical podcast on the guidelines for coping with Prader-Willi syndrome. You have 90 seconds to read questions 31 to 36. Hello, Mrs. Araceli. I am Dr. Gonzalez.
Hello, doctor. I would like to tell you something about myself.
Yes, please.
I have been married for 55 years and we have 3 children. The second child, who was born in 1964, had every kind of physical problem and was in the hospital for 10 months. However, we did not have a diagnosis until she was 4.5.
What does the diagnosis indicate?
Prader-Willi syndrome.
Prader-Willi syndrome?
Yes, it had a severe impact on my child in very complicated ways, mainly the damage of the 2 primary areas of the brain, the deletion of chromosomes 15 and hyperplasia. She is always feeling and thinking about food the whole time, akin to the feeling of starvation, and she never has the feeling of satiety. So this affects her daily life in an extreme way, and her tolerance level and the temper control, which is affected greatly.
Over the years, you would have experienced the communication skills of your doctor a lot. What is your impression in general?
We've been very fortunate for not having any bitter experience over the diagnosis. However, later on we have realized that he had suggested blood tests for her that were not actually required. That was the only bitter experience we had.
Actually, Prader-Willi syndrome is a complicated genetic condition that severely impacts several parts of the body. In infancy, this condition is identified by weak muscle tone called hypotonia, difficulties in feeding, poor growth, and delayed cognitive development. The patients develop an insatiable appetite right from the childhood, resulting in chronic overeating called hyperphagia and obesity. Some patients with Prader-Willi syndrome, especially those with obesity, also develop the most common form of diabetes called type 2 diabetes. The patients will typically have mild to moderate intellectual impairment and cognitive disabilities. Behavioral problems are very common, such as stubbornness, temper outbursts, and compulsive behavior. Sleep abnormalities can also be seen in the patients. Distinctive facial features such as almond-shaped eyes, triangular mouth, and a narrow forehead. Short in height, small feet and hands. Patients even have light-colored hair and unusually fair skin. Male as well as female patients will have underdeveloped genitals, delayed or incomplete puberty, and infertility is also common.
So is there any chance of curing Prader-Willi syndrome, doctor?
Yeah, but it's a lengthy process. Parents can enroll infants with Prader-Willi syndrome in early intervention programs. However, even if the diagnosis is delayed, treatments are available at any age. Therefore, for the patients with Prader-Willi syndrome, the types of treatment depend on the patient's symptoms. You can adopt any of the following steps that are suitable for the patient. Can use nipples or tubes for the patients with feeding difficulties. Special nipples or tubes have to be used for several months to feed the child with feeding difficulties, to make sure that the infant is fed completely and it has proper growth. The healthcare provider will monitor weight, height, and body mass index periodically to ensure proper growth. By supervising the daily food intake, the parents could prevent the overeating behavior that starts from 2 to 4 years of age. This will minimize food hoarding and prevent rapid weight gain and obesity. Growth hormone therapy has to be performed to increase lean body mass, mobility, and height. To reduce fat mass and improve movement and flexibility from infancy through adulthood. If the growth hormone therapy is given early in life, it may reduce or prevent behavioral difficulties. In addition, this can help improve speech, cognitive ability, abstract reasoning, and often promote information to be processed very quickly. It also improves sleep quality and resting energy expenditure. Growth hormone therapy is usually started during infancy or immediately after the diagnosis, and often continues during adulthood at 20% to 25% of the recommended dose for the patient. Many patients have trouble getting their eyes focused together. Such patients should be referred to a pediatric ophthalmologist. If necessary, an orthopedist will evaluate and treat the curvature of the spine called scoliosis. Sleep disorders are very common in Prader-Willi syndrome patients. Treating a sleep disorder in an early stage would help improve the quality of sleep. Muscle weakness is a serious issue among the patients with PWS. For children younger than 3 years of age, a physical therapy is essential to increase muscular strength to achieve developmental milestones. Generally, the patients have difficulty in controlling their emotions. Therefore, behavioral therapy could help to control anger, obsessive-compulsive behavior, and stubbornness, including an obsession with food. Medications, such as serotonin reuptake inhibitors, may reduce obsessive-compulsive behavior and also help manage psychosis.
Thank you very much, Doctor. That's been really useful. Thank you.
Thank you, Mrs. Araceli. Now look at Extract 2, questions 31 to 36. You hear the guidelines given by the physician on how to cope up with Prader-Willi syndrome. You have 90 seconds to read questions 37 to 42. Rejection of kidney transplant. What should I do? Rejection is the primary and prominent complication that may arise after receiving a kidney transplant. Since the individual was not born with a transplanted kidney, his body will consider this new tissue is foreign, and as a result it will try to attack the new kidney to protect the body of the individual. Rejection is a common response of the body after the transplant surgery. Therefore, the patient must take appropriate anti-rejection medicine as prescribed to prevent rejection. There are two types of rejections that occur after the kidney transplant. 1. An acute rejection occurs usually any time during the first year of transplant and can be cured successfully, whereas a chronic rejection occurs gradually over years. The causes of chronic rejection are yet to be identified by the research, and the treatment of chronic rejection is often unsuccessful. Immunosuppressant or anti-rejection medicines decrease the natural immune response of the body to the new foreign organ. The medicines repress the immune system and prevent the body from rejecting the new organ. However, there are also chances of getting cervical, colon, and breast cancer in women and prostate and colon cancer in men. Significantly, it is very difficult to diagnose the kidney rejection in its early stages. Also, the rejection is often irreversible once it starts. Therefore, the organ recipients should never stop taking the anti-rejection medication even if they think the new kidney is functioning well. Discontinuing the anti-rejection medication will encourage a rejection to occur. The numerous side effects of the immunosuppressant or anti-rejection medications are usually manageable by the patients. Blood levels after having anti-rejection medications have to be examined regularly to prevent rejection and reduce the side effects. High blood pressure, weight gain, getting infections, and an increased risk of certain types of cancer are some of the common side effects of immunosuppressant medications. The three groups of immunosuppressant medications are induction agent, a powerful immunosuppressant medication given before the transplant or immediately after the surgery. Maintenance agents are the second group of immunosuppressant that have to be taken regularly throughout the lifetime. Rejection agents are the medications that are used for treating the kidney rejection. However, since the immunosuppressant medicines lower the immune system, there are high possibilities of viral and other infections. Therefore, diagnosing and treating the infections at the initial stage is the best method to maintain the body and the new organ healthy. It is very essential to wash the hands frequently or to use an antimicrobial gel during cold and flu season. The patient should report to the physician following any of these symptoms: sores, injuries, or wounds, especially those that do not heal, symptoms of urinary tract infection like a frequent urge to urinate, pain or burning sensation while urinating, reddish or cloudy or bad-smelling urine, symptoms of respiratory infection such as nasal congestion, cough, sore throat and scratchy throat, running nose, or a fever. There are certain vaccines that will protect the body from infection. Also, certain vaccines are not good for a transplanted patient. For instance, the patient should avoid all live vaccines. Therefore, the patient should consult the transplant team before receiving any boosters or vaccines. The following are the common rules for receiving vaccines such as live vaccines, a flu shot, or hepatitis B. Hepatitis B should be received before transplant. Should avoid all live vaccines. Should avoid the nasal influenza vaccine. Should wait for at least 6 months after transplant or receiving a flu shot. Afterward, get a yearly booster injection. The patients who receive a live vaccine should avoid direct contact with the children received oral polio vaccine for 3 weeks. The children received measles or mumps vaccines. The adults received attenuated varicella vaccine to prevent zoster. The adults or children received the nasal influenza vaccine. The recommended vaccines are Haemophilus influenza B, diphtheria pertussis tetanus. Hepatitis B is safe before transplant. Hepatitis A should be given before traveling. Neuromax, single booster after 5 years of transplant. Influenza types A and B yearly. Inactivated polio. Meningococcus. Typhoid 6. The following live vaccines should be avoided: varicella zoster, smallpox, live oak typhoid, TY21A, and other newer vaccines, intranasal influenza, Bacillus calmette-guerin, yellow fever, mumps, rubella, oral polio, live Japanese bee encephalitis vaccine, and measles, except during an outbreak. The patient may develop diabetes after the transplant even if he did not have any diabetes earlier. This kind of diabetes is known as new onset diabetes after transplant, or NODAT, that can occur as a side effect of the anti-rejection medications. Kidney recipients are often at greater risk for heart disease. The many causes for heart diseases are diabetes, smoking, hypertension, overweight, high cholesterol, blood lipids, hypertension, and prolonged periods of dialysis. There are increased chances of cancer formation after the transplant. Therefore, it is very crucial to keep maintaining the immune system to prevent cancer formation. Since the immunosuppressive medications decrease the immune function, that will obviously decrease the defensive mechanism of the body against certain types of cancer, there are things that you can do to lower your chances of getting cancer. The most common type of cancer is the skin cancer that can result in the fatality of a patient. However, there are also chances of getting cervical, colon, and breast cancer in women, and prostate and colon cancer in men.